as a policy and advocacy manager, and I will be your moderator for this discussion. This is our weekly advocacy dialogue series where we discuss on impact of COVID-19 on children's rights. In each week, we discuss in a different topic. I think those of you who were with us last two dialogues knew our first dialogue was focusing on the protection of children during the COVID-19, and also impact of education was our last one. This is our third one, which is the role of media in COVID-19 response in Somalia. We have different experts and panelists joining us today from the media and communication people, to our education, to our health expert. So before I go directly to the topic, we start our dialogue, I would like to remind you that this is a public forum and all participants or people who are joining us this call will be muted except panelists and the moderator, of course. I want to remind you also that please mute your mics. Thank you. And also, please mute your mics if you are not speaking. Thank you. And also, please put your emails in the chat box so we can email you all the documents we will be presenting here, and also inform you about our upcoming dialogue that you may be interested in to join us. And also, please put all the questions you have and the comments in the chat box. At the end of the dialogue, we'll be able to pick them up and let our expertise panelists to try to cover them as much as possible. I would also want to remind you that this meeting is recorded, so it will be available on YouTube anytime you would like to rewatch it. Please visit Save the Children Somalia YouTube page, where you will find the recording and also our previous dialogues as well. The call will be 1 hour and 30 minutes. These are the key grounds I would like to remind you. I hope everyone understands that, and also you can please also put your comments in the chat box. Thank you. So we all know that in these difficult times, the outbreak of the COVID-19 disease 2019 has created a global health crisis that has had. Please mute your mics. If you're not speaking, including panelists, you will unmute yourself when you are speaking. So please mute your mics, including panelists. Thank you. So you all know COVID-19 has created a global health crisis that has, had a deep impact on the way we live and also the way we perceive our lives. Our world and everyday lives has been impacted. Not only the rate of contagion and the pattern of transmission threaten our sense of urgency, but the safety measures to put in place to contain spread of the virus also require social distancing, which has disrupted our way of life and the way we knew life. And also people during these difficult times, we know that we all as a public were relying heavily on media and media technologies to keep us updated, and also most importantly to be connected with our loved ones and also people around the world, and also the business continuity. So I think the fire hose of the information coming at us daily is all still overwhelming, and also newsrooms across the country and the world have made the pandemic gave the highest coverage and also was a priority. But ever changing and sometimes unverified nature of COVID-19 data, we have been seeing there will be mainstreaming all across the media. And also that has left us as a public and also the journalists, researchers, with a challenge in providing accurate information to the public to stay safe and also to have the right kind of, information. This also, had it's challenging, and also the way people were, perceive this information, this unverified information has been challenging to keep up with. it also makes difficult for the real, safety measures to be taken by the public, as there's lots of confusion around what's correct and what's not correct, that's really confusing. So we want to take this opportunity to this week in our advocacy dialogue series to really look at that. And we know that has been really key challenge we've been seeing during the pandemic. So in this dialogue, we will be discussing the role of media in raising public awareness and providing the factual information to support the community manage and contain the spread of the virus. And we will also discuss the key challenges and opportunities for the media to ensure that the public receives the right kind of information. And I think media is the first friend of the public. That's where if every one of us look up to have the kind of that kind of right information that keeps us all safe in these difficult times. So in order to make sure that we really understand how media can take part, raising awareness and giving us the right kind of information that we need to ensure we all have that right information to be safe. This week we invited 3 experts to actually take us through the topic. So first we will have presentation from Save the Children Deputy Director and also Head of Health and Nutrition, who is also our COVID-19 focal point, Dr. Biniam, who will take us through, and how the impacts of COVID-19 on health system in Somalia and make us understand the pandemic more deeply for the purpose of this dialogue. And also we will have Hassan Gaise from Dalson Media Group from Mogadishu. Hassan is a director of Dalson. Hassan will speak about the role of mass media in raising awareness and also informing the public on the COVID-19 data and how Somali media has contributed to that. And finally, we will have Kalson Ahmed Abdi, who is a communication and outreach specialist from Tala Initiative. Kalson will speak about how social media transformed into main information channel in the pandemic, but how did that social media contributed is negatively or positively, and how can we ensure that whatever we are seeing in social media is actually verified, and how can we use those social media platforms in an effective way to ensure that our public has the right kind of information that we need. So I think from me, that's the whole overall introduction. So I would like to give now the floor to welcome Dr. Biniam to give us an overview of the impact of COVID-19 in Somalia. Welcome, Dr. Biniam. We really appreciate your expertise and how deep you were involved in this, as you are also the focal point for Save the Children Somalia on COVID-19 response in Somalia. Please, you have 7 minutes to take us through your presentation, and I urge everyone, if you have a questions, please put them in your chat box. And as the panelist speaks, you have that kind of, while the presentation is on, that's the right time where you can pick your questions and not later. So please put your question in the chat box so we can pick them up later. Welcome, Dr. Biniam.
Thanks, Sayan. Thanks for the opportunity. Good morning, everybody. Participants, my co-panelists, and of course, Sayan yourself. So do you see the slides? I'm trying to share my slide.
Yes, we can see your slide.
Yeah, okay, great. That's great. Okay, so let me put it on slide mode. Okay, good. So I just want to take you through a few slides. First, where you are with the virus, the prevalence, and probably the trajectory from here, and then the impact of COVID-19, and then probably what we can do better, and then a few things about the media myself from from health promotion perspective, very much from the health angle. Yeah. So this is the figure as of yesterday. 3,051 confirmed cases in general with 92 diseases, and 1,264 people have recovered, and there are still active cases of 1,695. Yeah, so this is to show you, the kind of pattern in terms of the spread and record. This is based on recorded cases who have come for testing, but doesn't necessarily represent the figures in the community, because figures in the community we all believe in, we all know is much higher than this. But so if you go by this one, the first outbreak was recorded around March, and then a very slight growth until April, and then from April on, it really exponentially grew until end of May. Then from like June started declining, and then as we speak, there are only few cases recorded on daily basis. So if you go by this one only, you might take this as a kind of good picture, with a huge pinch of salt, of course, because, as I said, this does not represent the figures in the community. And we also know that not everybody is interested in coming for testing because of stigma, because of lack of incentives, okay, they are positive and so what, or also fear of isolation and so on and so forth. So I think all those factors have contributed to the slow uptake of the services available for testing, even if they are made available in many places nowadays. Why is this not going? Okay, so this is just to show you also the number of confirmed cases has in comparison with the number of diseases. As you see, in early days like in March, April, we had a higher number of cases diseases for a small number of reported or confirmed cases, but that has gradually reduced. And then even in the sometime end of June, there was no days at all with 0 case fatality. So this is also again, records from health facilities. We don't necessarily record, diseases in the community, and we know this happening, from some of our unofficial reporters, from grave diggers and so on. There are a number of diseases which have not been captured. So, but again, if you look at this one only, I think the generally good kind of picture, both from the case fatality as well as confirmed cases. So now, what did COVID-19 outbreak do to the health service utilization in general? We know globally health services utilization have dramatically dropped in many places, including even the neighboring countries, Kenya, Ethiopia, and so on and so forth. The reason is clearly, health facilities have been burdened by the outbreak, and then a lot of resources, human, financial resources, have been diverted to COVID-19 response. People also, for fear of contracting the virus, don't come to the health facilities, and also doctors, health workers have deliberately cancelled a lot of appointments for cold cases. So that all have contributed to the reduced, service utilization. Now, when we come to Somalia, this is the figure I just want to show you, according to the survey which the health cluster conducted. A reasonable number of respondents we participated. And what it shows here is a slightly different picture than elsewhere. We don't know why, we can't speculate. Of the partners who participated in the survey, 74% of them said the service actually has increased, or the utilization has increased, and then only 9% say the service utilization has decreased, and 17% say no change. In terms of the services which have high demand, it was all primary health care services, 61%, reproductive health, child health or similar, and then it goes on, mental health, psychosocial support, RCC. These are the kind of services which put a lot of burden to the health facilities. So this is slightly different, definitely, but one thing I cannot tell is whether it is based on data or observation. In other words, whether it's objectively verifiable data or just observation from health workers. So that is one thing I would like you to be keep in mind. And then we also did analysis of 3 projects of big projects of multi-million USD projects, OFDA, the one private donor, and CHASP, funded by CDC and SIDA. What this one shows you, of course, it is in the early days of the outbreak. April, this didn't capture the data, May, June. But what we have seen is like the brown one, for example, is OFDA, March, and then green one is Altani, and then the blue one is CHASP. And then if you go, can somebody mute their, yes, thank you. So this doesn't show any reduction. Actually, it shows a slight increase in March for some of them, and a slight decrease in for example, in the CHAS project has increased, OFDA has increased. Generally, there is no kind of significant reduction for MSH services as well as nutrition and or OPD consultation. But as I said, these are figures in the early days at the outbreak peak. But we want to assume that I think it didn't impact it much. Now, what does it mean now in terms of, I think, at outcome level? This is a kind of prediction from the Lancet series so back in May. For low-income countries, including Somalia, the prediction is that we will reverse most of the gains, in health indicators. So the figure here shows you, so gradual reduction of the blue line. That would have been the case if there was no COVID-19. But with COVID-19, the what you see on the this one, what you see here is the kind of increase again if we don't control the outbreak, And then all life-saving vaccines coverage will likely to drop by 20%. Facility-based delivery will reduce by 4%. Childhood mortality will reduce by will increase by 13%. So not good picture in general if we cannot control. But again, I will show you a few figures in terms of vaccination or uptake, courtesy to WHO, which was presented last time. So what it shows you, from figures of 2018, 2019, and then there's a gradual decline in 2020. If you look at the kind of orange section of the bar, that is increasing gradually, whereas the blue part of the bar is reducing, which is the number of uptake, whereas the orange one is the children who missed. That is the same across measles, polio vaccine, and so on and so forth. So clearly, not every child is coming to take services. So, and then this is probably to show you a similar kind of figure, which shows you a decline. And then finally, this one, number of children who missed from January to May figures in Somalia. You see gradually increasing number of children across all the pentas as well as measles and so clearly, even if at input level, we believe service utilization has increased, but at an outcome level, we see that children are not coming for vaccination. And then you have talked about, the other two components, mortalities. So this is what it is in Somalia now. Okay, so honestly speaking, we don't know where the trajectory of the outbreak, because we don't have data at the community level. But based on those ones, I mean, the confirmed cases reported officially, it looks promising. But in general, with a lot of cautious optimism, it looks like it's stabilizing. That's my assumption, totally personal, okay? And now, I just, I know my other panelists will talk about the media, but I think for me, from an health kind of expert perspective, I just want to, discuss few bullet points, what, the mass media can do, as well as social media can do in terms of health promotion, okay? So, I mean, we all know that mass media has a big reach, and it is largely cheaper. And what we know is also it is a good tool to increase knowledge and awareness. And then also it can give you, privacy somehow, as opposed to face-to-face discussion and so on. You can have the message from the media at your space and time. But it is particularly when there is no face-to-face opportunity, which is probably the best approach to kind of change behavior. It really is a good tool, or in combination, it can be a powerful tool to change behavior. And then it's also as good in terms of, I think, influencing, policymakers. And then there's also a thing called knowledge leveler. With repeated kind of media messages, people who are educated and uneducated become the same. I think you all have seen that everybody has become COVID-19 expert now, thanks to the media, so we have become even less valuable now because everybody knows about COVID-19. So, but there are things which we should keep in mind, even if media, the mass media can increase knowledge and awareness, there is no evidence that it can change behavior on its own. It has to be in collaboration with other intervention, particularly at individual as well as community level. There is also an issue of one size fits all. Unless we have a tailored message for specific communities, specific target groups, it just spread one kind of message to everybody without necessarily a thing called audience segmentation. We have to have a segmented segmentation of audiences, and then those messages should be tailored. I think mass media has a challenge in doing that. There's also a component of victim blaming, by trying to only, for example, promote hand washing. But do you know if people have water, for example? It doesn't necessarily look at some of the barriers. So if people contract, can somebody mute? And he can look at the participant list. He can mute them yourself. So if that person contracts the virus while you are telling him 100 times to wash his hands or her hands, then there is an element of blaming the victim because we don't necessarily look at those ones. Then it is often used for marketing purposes as opposed to selling health or promoting health. And of course, it makes also a wrong assumption of there is access and affordability for everybody. Do people have TV, radio, power to charge the things, And then the biggest challenge, I think, is the lack of interaction, which is, slightly different from social media, which outweighs, I think, mass media when it comes to that. So lack of interaction is an issue. Then unless, messages are repeated from a study in Ethiopia, people have poor recalls of the media. And then, it might miss primary targets because of the blanket kind of messages. Now, a few things on social media, which is, a good thing. It has become gradually cheaper and cheaper, smartphones as well as internet availability. And it's participative. That's a very good thing about social media. And then it has also potential to reach marginalized groups because it can, segment the audience, which, the other media cannot do. By specific geography, sex, and so on and so forth, we can use location and so on and so forth. It's low cost. And then it only uses, existing like Facebook and the Twitter, the YouTube, not necessarily creating your own application. So I think, this is repetition, the ability to tailor messages and to contextualize is a very great thing. And then the potential for social media, to contribute to health promotion is huge. And then it can also give messages to a safe and private spaces. And that is a huge implication in terms of stigma. So the last slide is about also some of the shortcomings of the social media. I know my colleagues are going to discuss this, but I think I want us to kind of see their own self-assessment of, contributing to health promotion, both from mass media, social media, from this perspective, whether they have addressed those challenges and so on. So, I mean, to your disappointment, there is also overall little evidence of efficacy of social media on health promotion on its own. This is from my, textbook on health promotion from 2013. A lot has happened since then. There might be new evidences about the social media impact on health promotion, especially on behavior, but they contribute definitely. And then also they talk about there is no precise pathways, clarity, how social media intervention impacts health promotion and its outcomes. That is for health promoters kind of evidence, I mean, it's not for us, but that's also one challenge. We know also social media, there are good things, a lot of good things about it, but there are also a forum for stigmatization and teasing, because it is free space for everybody without with no accountability. Of course, it's also known for giving inaccurate information and fake news. And then because of that, I think lots of people are losing trust in source of information in social media in general. And then finally, that digital divide. I think making a wrong assumption that everybody would have access to social media, whereas the illiterate, the marginalized and the poor don't necessarily have phones and the internet and the capacity or the power to charge their phones and so on. So I think I thought this would be useful for you now to kind of consider in the subsequent discussion. With that, I rest my case. Thanks for your attention. Thank you.
Thank you so much, Biniam. I think that was really comprehensive, information. So now I would like to move to our next, panelist, but I would like to remind you that you leave your emails in the chat box, so we are better able to send you all the document now Dr. Biniam has, shared, and all the other documents that other panelists will share. And also please mute your mics, including panelists if you're not speaking. Leave your question in the chat box while the presentation is happening. From the panelists, that's the best time you can ask your questions. Please put your questions in the chat box. So now I would like to invite our next panelist, Hassan Geyser from Dulcin Media Group. Hassan will speak about the the role of mass media. It has been, covering COVID-19. How is it contributed to the fight against the disease? And what role did the media, play to ensure that the public has the right information about the disease? And also how media has been, raising awareness and also role that media has played. Welcome, Hassan. The floor is yours. You have 7 minutes. Hassan, can you hear us?
Yes. Can you hear me now?
Yeah, please mute your mics, please. If you are not speaking, please mute your mic.
My mic is on now. Can you hear me now?
Yes, we can hear you, Hassan. Go ahead.
Thank you for inviting me this panel. And I would like to take this opportunity to read my presentation about role of the media and how the media contributed to the fight against COVID-19 in Somalia. As you know, the media has contributed much when it comes to the fight against COVID-19, especially conveying the much needed information about the COVID-19. And I believe without the media, people have affected seriously. So especially,
can you come back on video mode?
Sorry, we developed.
Can you come back to video mode?
Yeah, we can't see you.
Yes. So let me turn on my. Now?
I think it's coming, but you can go ahead. Yeah, we can see you now.
The pandemic has seriously affected the Somali communities with more than 3,000 confirmed cases, which represents the one of the largest infection in the Horn of Africa, as you know, Somalia. And the Somali media has been vital in providing the necessary information to society, like washing hands, using face masks, and also to practice the people social distancing. Through the media, we use debates, messages. We also use to invite imams and health experts to awareness the people. I remember as a Dalsan Media Group, we have a radio, we have a TV. We invited one of the famous imams in Mogadishu for live talk show. Then we also open the people to ask a question about, as you know, the first breakout of the pandemics. All the Somalis, or most of the Somalis believe that this disease only for non-Somalis. So there is a false news here also. We used to spread some people saying Somalis are safe. So we used to awareness this to start this campaign using religious leaders. And we have raised and educated the impact of the COVID by also interviewing health experts and also Minister of Information officials. Also, we have been trying to use our prime time to air short messages showing our listeners and our viewers that this is very dangerous and they need to take care. And I think Somali media voluntarily played a role to awareness the Somali people. So when it comes the challenges, the biggest challenges to Somali people faced was the myth that circulated among the Somali people, which say in COVID pandemic is a disease for the infidels, not for the Muslims. And also people has been saying also this is fake news. Somalia not yet reached the pandemic. So all this became a challenge for the media to learn people that the COVID-19 is around and people now are dying. And also we have been trying to engage the health experts to invite them to the panel, give them a chance to educate the people and just say something about how this pandemic is serious. And also the problem or the challenges we have been facing as the media or as a journalist was, as you know, Somali journalists, they are not trained for this disease, COVID-19. So I remember, I think it was April, four journalists exposed corona after they visit the headquarters of the, I think it was a hospital. Then another journalist visit their colleague. So also one of the challenges that we have been facing, even the journalists, they don't have idea how this virus is dangerous. One comes also the information, the necessary information that we need. Ministry of Information, sometime we didn't get the real information because of that misinformation. Also, one of the challenges that we have been facing as a Somali media. The other challenge, most of the Somali people also were breadwinners, especially the IDPs, as you know, and will not have stayed home to self-quarantine. So they have any other means for survival. if they stay home. So they die for hunger, and if they go outside to seek their daily meals, you know, the government imposed lockdown, several affected, which was also unnecessary. The people should have been informed and educated about the necessary information and preventing through the media, as media did as well. We used to develop our message voluntarily. Also, I remember UNDP and other international NGOs used the media to awareness the people. Also, Dalsan Media Group, Radio Dalsan, is a partner with the BBC Media Action. We have been working a program called Braruk Bulshada or Braruk. That program also we joined to use to campaign or to awareness the people, using interviewing the health experts, also to invite the expertise. So we usually do to invite also the government officials in our studios, the TV and radio, to encourage the people or to want the people to self-quarantine or also to be safe. So as a media, we have been trying to educate the people using our platforms, using social media, Facebook, using Twitter, using our radio. And there is also a challenge. As you know, a small number, the Somali community has internet access. So as a Dalsan, we have been trying to reach the rural area people, and the people don't have internet bundles to reach our radio, especially the IDPs. As you know, they don't have access to the internet. So we have been trying to reach through our radio. Most of them, they use a radio. So as a Somali media, I can say we have played a key role to campaign to advance the people through our platforms. That's my presentation. Thank you very much.
Thank you so much, Hassan. I think that was really useful. Please, can I remind you again to ask your questions and put them in the chat box so we can pick it up after the last panelist presenters. Thank you so much. I know we have a lot of media houses, you know, attending the call, and the communications people. Kindly ask your questions so we are able to pick them up when we, you know, finish the last panelist, which is coming now. Thanks, Hassan. I think that was really, you know, kind of key information to know what is the real with the local media and the role they are playing to ensure that public has the right information, and also the challenge they are having themselves. So now I would like to, you know, invite Kalsan Ahmed, who is a communication and outreach specialist from Talo Initiative. Kalsan will take us through, you know, social media has been, you know, key information channel, you know, especially for Somali people. Has it been used effectively, you know, to kind of raise information, to raise awareness of the pandemic, and also educate the public? And also, we know there's a lot of misinformation, rumors, and fake news in social media. Concern will tell us about how can we better, you know, use social media to ensure public has reliable information. Wilton Concern, the floor is yours. You have 7 minutes.
Assalamu alaikum, everybody. Thank you very much, Ayan. I will be remiss if we ignore the fact that Somalia is still a very dangerous place, and especially for journalists. In fact, yesterday was the 1-year anniversary of Hodan Nalaya's passing. She was a prominent Somali communications expert, and also ran a online TV, and also our sister Almas Elman, who was also a communications expert working in Somalia. So, and you know, we can name more and more. These are just 2 women that we lost last year. And so the context remains, and I think we should always be considering that element when we talk about media and the impact of media in combating COVID-19 in Somalia. So Somalia the Somali media landscape is dominated by broadcast media. So especially radio, and now TV is also growing. Internet is not accessible to everybody. It's limited to major cities and to those people who can afford smartphones, internet bundles, and those who are literate, as Dr. Benjamin Gebru had highlighted in his slide previously. It's important to kind of put the numbers here so that we have context. So the country's average literacy rate is 38%. It's higher for men. Women are even further disadvantaged because they have the lowest literacy rate of 25%. And also internet penetration in Somalia is about 10%. So about 1 million people in Somalia have access to the internet out of approximately, I think between 15, I think we have about 16 million people. I'm not quite, I don't quite remember exactly what the number is. So, so it's quite low, but when we talk about social media engagement, I think it's important to remember that we also have a very active Somali diaspora community that is very engaged, and also the Somalis in Somalia who are using the internet are also very savvy, and this is in part to our culture. We have a very vibrant arts culture where we have a very we're considered the country of poets. So we use internet and especially social media in very interesting and creative ways to disseminate information. However, the internet is also or social media is also very notorious for disseminating fake news. So and also, again, as Dr. Gebru had highlighted, everybody has become an expert. So it's kind of challenging to understand if we're not really tracking what's going on and what the conversations are and what information is being shared. So obviously there's some tracking that needs to happen so that we understand better what the conversations are among the Somali population, both locally and abroad, around COVID-19. But I'll just give two examples which were very good examples to share. So the Somali diaspora started this campaign called Toss the Roll, and this started around, I think it was in March, where young men and women were challenging each other to kick a toilet paper roll, and then they would pass it to each other. So that was in the beginning of the pandemic. That was before we started to see cases in the community. So it was quite joyful, It was very uplifting because many people were now locked into their homes and they were trying to find things to do and also engage with one another. So that kind of brought us together, in a way, because we were seeing what other kids are doing around the world, and especially Somali kids. So, generally, I think Somali have been winning the internet, especially Somali diaspora. When you look at, for example, the I Can't Breathe, the Sister Floyd campaign, Somalis have been really effective in getting their message out there and also being, active advocates for justice in America. So these are just two examples that I wanted to highlight, of how Somalis are using social media to kind of get their messages out there. And there was also the Justice for Shukri, which is happening in the UK. So Somali need to get their messages out there, especially the Somalis in the sorry. So I just kind of got lost track there when somebody was talking on the background. So active Somali, youth Somali on social media.
Sorry, can you please mute your mics, please? Conson, you are on mute. You are on mute. We can't. Yeah, we can hear you.
Okay, thank you. So we have a very active, like I said, a very active youth population who are families that have high internet penetration, and also we don't have a very high
Conson, you are breaking. Yeah. Yeah, you are breaking. We barely heard you. Yeah, we can hear you now. Go ahead. Conson, we can't hear you. I think you are breaking.
Okay, so what okay, just give me 1 second. I'm just going to switch internet.
You are good now. Go ahead. Okay, I think as we wait, Conson to come fix the internet. I think we all have that. Yeah, we can hear you now.
Okay, perfect. So the challenge is we have a lot of information in how to manage, in how to prevent the disease, but very little is known about how to manage the disease once you get it. So I was one of the first people who actually came out when I actually got sick around mid-April, and shared my story about what was going on, how I was managing the disease, and what challenges I was experiencing. So I got a lot of, backlash from some of the people online about, I shouldn't really be sharing, what regiment that I was using and, what I was doing. So it was very challenging because, we have a void of information out there about what to do when you get sick. And here are people who are, and legitimately actually, who are saying, maybe what you're sharing could put people's life at risk. So I can understand where they're coming from, but I think we need to share more stories about people who are getting sick and how they're combating the disease, and especially if they don't have to go to the hospital. I was one of those people who was scared to go to the hospital. I'm actually in Mogadishu. And I was a bit scared because it was earlier in the disease, management process that I got sick, and so we were not sure where to go to get tested. It was around that week when the testing center was established. So it was very early days, and very little is known about the disease. So I was worried that if I went to the hospital, that I would actually, get sick or, put myself at further risk. So there's a lot of, there's a huge gap there of information, even for a person who is, literate like myself, and somebody who considers themselves, relatively informed about things. But, this disease is just one of those things that has hit the global community. It's new, it's challenging, and so we are having to adapt, including even how we engage with each other, and especially how we communicate with one another and share information online. I wanted to say that, how can the humanitarian sector, help or come in this case? I think there needs to be more studies to understand, especially the impact of COVID-19 and how information is shared, especially online and among the Somali community, and what they find useful and which can be propagated. We need more training for both youth and journalists on reporting for COVID-19. Basically, how to do videos, making sure that, the information that they're sharing is factual and that it's based in reality. And also supporting original content creation. So a lot of the information which we are experiencing or being subjected to both online and in mainstream media is just a translation of global information or global protocols. And I think we are a very unique, interesting community, and people have a unique way in which they understand information and accept information. And I think that part has been missed for us. I think providing information that is important, but in a creative way and in the language of Somalis and in the way that they would accept it and be more useful for them. So using theater, we have a very vibrant and art culture in Somalia. So we need to kind of take the resources that we have and also give the artists, give the youth an opportunity to come up with interesting messages that can be shared both in mainstream media and online. And that's the part that I find is missing. And I think many other communities in Africa will probably have the same challenges, that the information that is being shared doesn't necessarily adapt to our traditional languages and culture, and doesn't really utilize the resources that we have locally. And this is an opportunity to also create jobs. This is a place, where we have a huge youth population, but very little opportunity. But, we have young people who have ideas and are very creative and could use the opportunity to kind of engage with this kind of information. So I think that is where the opportunities lie. So Talo Initiative got a grant from an organization called Purpose. So it's a small grant to work with youth to combat misinformation. So we are working with artists. We're going to be working with artists profiling their artwork. So this is visual art, digital art to combat misinformation. I think we've already seen some of that online in terms of, like, you've seen, for example, a young lady called Nujum, who's a very prominent artist here in Mogadishu, who has come up with some beautiful artwork, that shows people wearing masks, that shows people social distancing, and a lot of this is available for sharing online. So we're going to be doing a lot of that, so profiling young artists and the work that they're doing. We'll also be providing training for youth on how to develop content for online media. We'll also be doing an exhibition at some point in September, where we'll actually take the artwork that they've produced and have a physical exhibition, either at the new theater that was launched recently, or somewhere that that people can actually go and see and touch the work. And then we've also through the work that we're going to be doing with Purpose, is we'll also be developing a database of young, active activists and youth, who are engaged in this work, that can be used to do surveys, that can be used to, to engage them on further activities around, managing, COVID-19, disseminating information, and other.
Yeah.
So I think I'll leave it at that unless anybody has any questions. But I tried to share as much as I could based on just my personal experience.
Yeah. Thank you so much, Kansan. I think that's really important that we understand the power of social media and how to use effectively to educate the public about the right kind of information about the pandemic. And I remember that you were one of the first people who had COVID-19 and came on public to push that kind of a stigma around people sharing their stories, and also educate the public about the right kind of information. I think that was really powerful, and what you did really had made an impact for other people coming out and saying, hey, this happened to me and it's not end of the world. This is what it should be done, and you need to follow the expert advices. Thank you so much, Kasam, for that. I think it's time for picking the questions from the chat box and also from people who joining us. I think we have a lot of people, more than close to 50, and I urge everyone to, you know, put your email address in the chat box so we can contact you and send you all this information. So now I would like to pick up a question. I think this question goes to Hassan. Hassan Gates will be, I think, will be answering this question. So it says, my question, Abdussamad Yassin from Care International, I think that's Somalian Consortium, if I'm not wrong, asks this question is that in Somalia, during the crisis, local and international media coverage plays an important role in shedding light and echoing humanitarian needs, which helps access to fundraise and reach wider audience. And we know Somalia has a very complex, you know, humanitarian crisis, from drought to locusts to, you know, food insecurities, you know, so lots of, you know, complex humanitarian needs. Abdulsamad is asking Hassan, COVID-19 is a global pandemic, and that's, you know, absorbed by international media, and Somalia hasn't got the attention of international media. How does that affect, you know, the COVID-19 response, as Somalia get the minimum attention from the international media? And also that kind of created a gap for and access, especially humanitarian actors operating the country, to have, you know, kind of fundraise, because, you know, the international media hasn't covered Somalia that much. So I think I give this question to Hassan. I urge you all to ask the questions as we have now. I think we have 30 minutes to ask and answer the questions. Please keep your answers short. I ask this to the panelists so we are able to cover as much as questions as possible. Hassan, welcome. Hassan, can you hear me? Hello?
It shows that Hassan has left.
Yeah, I think he's having technical internet problems. I think while Hassan comes back, I will go back to a question to Dr. Binyam. I think there's a couple of, you know, 2 questions for Dr. Binyam. So number 1 says, in Somaliland, the results of COVID-19 are not coming too early. So if the person shows the symptoms of COVID-19, what would be your advice? To stay home in 4 weeks or 2 weeks until he recovers from the virus? I think that's from health perspective. The second question to you, Binya from Jamila, says, if children are not getting their essential vaccine, what will be the impact of the future of children in Somalia? I think that's very, very important, you know, question to look at how children are impacted. Welcome, Binyam. Binyam, you are on mute, so we can't hear you.
Okay,
yeah.
Great. Yeah, so thanks. Yeah, so basically, thanks for the question from Mohammed. Yeah, ideally, or, you know, if possible, it's good to have always a test, but it's not a must. You know, there are 2 ways of diagnosing COVID-19. One is the lab test, which is useful, especially if you are suspicious, if you have contacts but no symptoms. But if you have symptoms, you know all the symptoms are, but, you know, and then if you have those clinical symptoms of fever, headache, and cough, especially lack of taste and smell and so on, I think it's good to assume that you have it and then stay home for a minimum of 14 days, and then also for additional, you know, probably 2 to 3 weeks once you are symptom free, because there is a possibility of carrying the virus even if you have no symptoms. So yeah, so it's good to have it, but it's not a must. Even in the best, you know, setting in Europe and America, they call when, you know, people call health workers, they ask them to stay home, assume you have it, and then yeah, observe all the kind of precautions as if you're tested. The other one good thing, of course, having a test, if it's possible, is also to repeat it after you are symptom free, and then it could tell you whether you are carrying it or not, because the risk of carrying the virus, from the carrying the virus, there is a risk of transmitting to others. So yeah, I mean, yeah, it's not a must, but if you have it, well and good. If not, assume you have it and then observe all the precautions. The second question from Jamila is pertinent. Yes, I think that is probably the key point of this discussion. Yeah, so if children are not coming, for vaccinations, either as a new, kind of a new attendance, as P1, for example, the pentavalent one, or lose, the second, the third one, and so on. That means that they will not have enough immunity to fight off infections like the pertussis, the diphtheria, tetanus, measles. All these, illnesses can kill children. So the fact that they don't come to the facility means they might fall ill, and then they might also die. They might also transmit it to others because they are all, transmittable illnesses. So yeah, so hopefully, with the kids stabilizing, we will recover those children and then have them, in our kind of services. Otherwise, there will be more kind of morbidity and mortality, and that also means reversing our gains of all this reduced under 5 mortality for children for the past few years.
Yeah, thank you so much, Binyam. Hassan, are you back in the call? Hassan? I think Hassan is having a technical problem with the internet. My next question goes to, Colson.
By the way, there are also people who have raised their hands. Maybe you can mix.
Yeah. If you raise your hand, please repeat so we can see who's raising their hands.
Mohammed Gas. Mohammed
Gas.
Yeah,
please unmute yourself and speak. Thank you.
Thank you very much. I was in fact trying to type my, it is a comment, it is an opinion or support of what Kalson was saying about the idea of relating the services to the needs of the Somali people. As a media fraternity, we have seen a lot of gaps in regards to how we address this COVID-19 issue. By that, I mean that we are trying to show that COVID-19, to prevent COVID-19, wash your hands, stay away, and cover your mouth and nose with the mask. And this is, as Kalson said, we are trying just to translate what is coming from us from the first world, without trying to look into ourselves as the third world and try to address these issues, putting our feet in our people's shoes. That means there are people, we all know that Somalia ranks 194th out of 195 of Global Health Security Index. That means it's just above Equatorial Guinea. And healthcare standard is 25 health workers per 100,000 people. Here we have 2 health workers per 100,000 people. So as Kalson said, we are at a greater risk when we look at the terrorists issue, the locusts, the floods, and now we come to the COVID-19. Let me just cut a long story short. We say that put your mask to prevent you and the others from getting COVID-19. our poor mother who is in the rural, who brings milk every day to the city, thinks when she's given such an information, she even thinks that maybe this mask is medication. So when one person comes from the town, tomorrow when another one wants to come to town, it's very easy to ask to borrow the same mask the other one was wearing because she's going to town, thinking that this is going to prevent her from the disease, taking it as if it is medication. So as media and also international organizations that are working here in Somali country, we need to know the problem of our people from the grassroots, what can be done in places where people don't even have water to drink, live about washing their hands. How are we going to, what information are we going to give these people? We are not just supposed to be translating what is coming from the Western countries where there is water everywhere, even in their countrysides. We have to look at the challenges that we face, as Hassan was saying. The journalists themselves have a lot of problems that they are facing. How can we train these journalists? How can we equip them? How can we help them to give the information that translates to the need of our people rather than hand washing and keeping distance? Because in Somalis, the biggest problem we have is our cultural behavior. Because you will see even the traditional elders, when a new traditional elder is inaugurated, you will see that they drink camel milk from one pot, all of them, it goes round. So how can we tell these people the danger of, because he can wash his hands 10 times, but this ceremony comes, he must do the rituals. How can we stop them? Who are we going to use? So it's for us to choose the people we use, as Hassan was saying. We use the traditional elders, we use the religious elders, we use our doctors, experts, and most of all, our doctors who face these problems from the patient who come from to them from within, so that we
Yeah,
tackle.
I think Ayan, I don't know if you want to shorten the question, ask him to answer the question.
Yeah. Can you please summarize the question?
My question is, how can the Somali media or the media fraternity working in Somalia and the international organization who are on the same side fighting this new coronavirus from spreading, and also the COVID-19, how can they come together and work with regards to how they can tackle this problem
Thank
on
you.
local context?
Yeah, thank you so much for your question. I give that to Kalsan. You want to address that?
I will also say something after that.
Yeah. You are on mute. Yeah. Kalsan, we can't hear you.
I just wanted to add, hi, can you hear me now?
Yeah. Still, we can't hear you.
Hello. I just wanted to highlight, something that I almost forgot. We have a lot of discouraging stats when you look at, the situation in Somalia when it comes to the health situation, when you look at, ratio of doctors to patients, those are really very discouraging. However, we have other areas, where we are doing well. And one of those areas is, the Somalia is one of the countries now that is listed as having affordable internet. You know, so when the COVID-19 pandemic hit, the mobile providers, including and especially Hormuz, reduce the prices of internet so that the young people can learn online. So a month of unlimited internet in Somalia is now only $20. This is amazing. I think you can't find this in many places. So as you can see, this is something encouraging to actually talk about. But to go back to what Mohammed Gas was talking about, when you mentioned those messages that were being propagated where it shows people washing their hands, covering their faces, and all of that, you know, when the disease hit, and even still till now, we have even people who are relatively, you know, aware, educated, who still don't get it. You know, they still don't understand the severity and the actual situation. You know, they're still in disbelief. You know, you don't get it until actually you see it happening to you. You know, it's something that hasn't happened in our lifetime. So all of this is very new to all of us. You know, I've been trying to fight with my dad all of these days, you know, to get him to not have visitors at his house, you know, to wear a mask when he goes out, to not go out to people's houses. But, you know, it's very difficult to kind of explain this, you know, this situation to people, you know, who haven't experienced perhaps something like this before. So it's a challenge. And images, they are very powerful. So when we're seeing images of, you know, people washing their hands and you know, covering their faces, but they are not Somali or, you know, or illustrations of Somali looking images, that I think is an opportunity missed. You know, that in a way could have been used to translate, you know, very powerful information to a local context. So Somalifying doesn't just mean that, you know, you just change the text and make it Somali, but you also need to change the images, you know, and the representation to be of that people who you're trying to message to, so that they can actually see themselves in the message and be able to act and adjust accordingly. And one thing that I don't want to miss.
And sorry, Kalson. Please visit BBC Media Action Somali page. You will find those things you're talking about in Somali by Somalis.
Yes, yes. However, I'm yet to go and look at it. I'm sure they're there, but you know, we're talking about propagation. We're talking about having it mass shared and being going viral online. We're not having a lot of that. I saw a video that was done by Kenyan cartoonists and having a Somali man and a camel talking about, you know, social distancing. That was really fun, and you know, Somalis can relate to that. Camels are very valuable to Somalis. A Somali guy wearing a ma'awis and a kofia saying something funny about social distancing, that's messaging that kind of sticks. And that's what we need to be doing, trying to create messages that stick, that people can relate to, that people can see themselves in. The thing that I didn't want to forget is, you know, we need to really examine the source of information. So when the pandemic happened, and even as it continues, a lot of the information that we see, and even not just Somali, but this is also the case in Kenya, is we are getting these press conferences where the government is the one that's providing the information, rightfully so. But the information is really the numbers, you know. But what we need is more than the numbers. What's behind the numbers? Who can translate this to us in stories or help us figure out what's really going on and how we can connect with that information? So that's important. And I think in this process, women and youth are really left out of this whole process. And I'm worried about that, because if women are not online and if they're not being messaged to, then they're the ones who are being disadvantaged and they're the most at risk. So we need to adapt our communications. We need to adapt our strategies to ensure that, you know, we're doing deliberate, targeted messaging to the very vulnerable including IDPs, but also women in particular, and women, so that they can also disseminate the information to their children, to the youth around them, because it's important to understand that they are also very key pillars of society and where people go for information.
Yeah.
Right?
Thank you so much, Son.
Yeah.
Binyam, you want to add?
And so just to say a few things, I think I briefly mentioned, earlier about the shortcomings of the social media as well as the mass media. What they can do good is in terms of, I think, increasing people's knowledge and awareness about the illness, but they don't necessarily change behavior on their own, because behavioral change is such a stubborn thing, to change. It's not easy. It would require a number of other, intervention together with the mass media as well as social media. That would involve communities or individuals directly, either on face-to-face, but the engagement bit is key. So I'm coming now to the RCCE. Risk communication and community engagement is a key, because that is the only way you would know what the barriers for people's behavior change is. Because without knowing the barriers, for example, I think my friend has mentioned, you tell them to wash, but they don't wash. Is it because they don't have water, or is it because they underestimate the risk of the COVID-19? You tell them to wear a mask. Do you know that they can afford to have masks and so on, or have you given them alternative, cheaper solutions for masks and so on and so forth? So so without having other community engaging interventions at the community individual level, you will never bring about a change in behavior, because it's very difficult. And then I don't want to really underestimate the crucial role those the media outlets could play, but we should be also mindful of those shortcomings and limitations. So it's not enough. So we have to work together, but we have to have a kind of community engagement, and then our messages should be based on those barriers, and then there should be a collateral, a parallel intervention to address those barriers. If it's about water, can you provide water? If it's about mask, if it is social distancing, there, is it possible, for example, in such housing situation which Somalis live? And then, if it's about lockdown, can people afford to, stay at home without working, and so on and so forth? So and it's very easy to kind of transmit messages of media, but it's not, easy also to kind of identify the barriers to those behaviors, and without addressing them, you can spend a million kind of dollars on media. It's not going to happen. So yeah, I mean, I agree with his observation of, I think, that slow change. Even her own dad, but I think there are other things we need to factor in. Thank you.
Yeah, thank you so much. Thank you so much, Binyam. I think we have less than 8 minutes. It's unfortunate that we lost Hassan due to technical internet problems. So I would like to wrap this discussion by giving each one of the remaining panelists, Binyam and Kalson, to give us 1 or 2 key recommendations and takeaways we are taking from this dialogue, and ensuring that we manage the misinformation and ensure public gets the right information as international organizations and media working together to ensure that our people have the right kind of information to be safe. So I would like to give this opportunity to Binyam first, then Kalson. What will be your 1 or 2 key recommendations you are leaving in this discussion? And then we will wrap the discussion. Thank you so much.
Good. Yeah, thanks again. So for me, definitely, as we speak, there is no cure or medicine to treat COVID-19. There is no vaccine. Inshallah, I think probably toward the end of the year or early, next year, there might be vaccines. So in the absence of, cure, in the absence of preventive, like vaccine, the only modality or solution or weapon we have is prevention. So prevention is key. And then, government has a role to play. Health workers or experts have a role to play. The media have to play, but the ultimate responsibility lies on individuals and then individuals should take responsibility. That's a very key thing because that's where it happens. But I really want us to work together with the media, particularly mass media and social media, because we can help them in refining messages. We can, help them in providing them messages which are tested. I think the biggest challenge now is all the testers are, the messages are everywhere, but not necessarily properly tested. We know it requires time and resources. It's not easy, but I think if we work together, we can probably develop a more relevant, tailored, to specific, target groups, and probably the one also which can probably, as other than the kind of tailored messages, I would also like to mention the kind of intervention we as health workers or humanitarian workers needs to address in terms of the WASH element and the socio-economic empowerment element and so on, which are key to also I think key to kind of individuals to make those decisions. So I look forward to working with our media colleagues, and then thanks Ayan, thanks everybody for the participation.
So, you are next.
I have to agree with Dr. Gebru. Yes, we need to really have strategic communications that's actually measured and that's targeted. I cannot dispute that. We need more of that. Where I would say we can focus also some of our efforts is in really trying to bring the opportunities down, at the community level. Yes, the government has a huge responsibility. Yes, the health workers, and we can say that, the ultimate responsibility lies with the individual. However, I think the community, the Somali neighborhood also can play a role in prevention. And yes, I agree again, prevention really is the key here. We have mosques, we have imams and sheikhs, we have elders, we have community groups that come together. Either it's the women who are weaving baskets or selling goods in the market. They are the first responders to a certain degree, in terms that they are the ones who are kind of affected and can see the effects of the disease also firsthand. So maybe sharing information with these key influencers and having them disseminate information effectively to their community, to their congregations is also important. One thing we really missed when we were talking about social media is WhatsApp. It doesn't really fit in social media. However, it is social media. It's a messaging application, but yet it's been the source of a lot of fake information. Our moms have become experts at COVID management because of all of the videos that they've been receiving on their WhatsApp from the different people that they've been getting them from. So I think there needs to be a way to kind of curtail some of these tools and sources of information. I don't know how to do that, but at least improving the education or helping these community members become more aware of fake news. So if we can have, sessions in the community for journalists especially, but also community members, of how to identify fake news and how not to share or disseminate that information, and also just, how harmful that can be. And now more than ever, actually, because we've seen the effects of, fake news and how harmful they can be in terms of giving people wrong information and how to manage the disease. And I would say, so just we need to focus on training for journalists and helping them understand the disease and how to communicate for COVID specifically. We know how to communicate for for when crisis happens, for floods, for, locusts and all of these things. But we need to really have a healthcare perspective on this COVID reporting, which I think is lacking in this whole process. And then we need to really support young people, community art producers, to come up with products and messaging that is really Somali for Somalis.
Yeah, thank you so much, Kassan. I think that was really helpful. And thank you so much for, participants coming on board with us on this dialogue. And I think it is about time we wrap this up. I would like to remind you that our next upcoming dialogue will be on the 27th, and we will be discussing, the social protection impact of COVID-19. Of course, always it will focus on children, and how basic, social protective services is impacted, and how can we ensure that children have, access to this, along, with by urging the government to take the appropriate steps. So thank you so much. Please, stay with us, be connected to us, and be informed our upcoming dialogues. And always you can watch the dialogue that we do on next day on our YouTube channel, Save the Children Somalia YouTube channel. Thank you so much, everybody, and I will see you our next dialogue. Have a great day, everyone. Bye.
Okay, thank you. Bye, guys.
Thank you, Nubina. Thank you.
Thanks.